Hello, everyone, and welcome to this month's Heart Bunch video, the Health Extension Advocacy Research and Teaching Initiative video this month. We're going to talk to you about prescriptions and prescription opioids more specifically. Did you know that opioid safety begins with prescription safety? It's true that a lot of us have had an opioid prescription at some point in our lives. However, approximately 80% or 4 out of 5 people who are using heroin first reported misusing their prescription opioid that they got from their doctor. So it can be a very slippery slope. So we're going to talk about a few ways today to help you be very safe with your prescriptions and refer to these different resources that we're going to give you to help you along this journey.
The first item I'd like to discuss is speak out. Have the opioid talk. Become an active participant in your healthcare, especially when opioids are involved. Did you know only 48% of Utahns talk to their doctors about the risks of using opioids? We encourage you to ask questions about the risks and discuss options for painkillers with your medical or dental provider. Be prepared. Write your questions down before you visit or go to the Use Only as Directed website for more information. And before you accept an opioid prescription, ask these 5 questions. Number 1, what is my risk for addiction? Number 2, is there something else that would work? Number 3, is this prescription the lowest possible dose? Number 4, how long would I take them? Number 5, how would you plan to taper me off? These questions are hopefully going to help you take control of your care and learn the benefits and dangers of opioids. So we encourage you to ask questions and speak out.
As Tim just mentioned, one of the questions is focusing on what other options are. And so that's what I'm going to talk about, opting out of opioids by using an alternative pain management technique. Some techniques that have worked well for people, I'm not going to give you the entire list, but just to kind of hear about a few. Yoga and stretching can really help reduce pain, strengthen muscles, and calm the mind, all of which can be really beneficial. Got meditation and deep breathing. We don't really know the exact biochemical pathway that really helps ensure that mindfulness meditation helps relieve pain, but there's a lot of evidence to show that that is the case. Acupuncture is thought to decrease pain by decreasing chemicals that block pain called endorphins. And so that can be a good technique that works well for some people. Chiropractic treatment is really one of the most common non-surgical treatments for back pain. And then Reiki healing. This is more of a therapeutic touch and is really thought to help activate this self-healing process within the body. Like I said, there are a lot more options out there, and I would recommend trying a variety, seeing what works best for you and your body, and also keeping in mind additional over-the-counter non-prescription pain medications, ice packs, hot packs, and a variety of other methods to kind of help you reduce that pain in a way so you don't have to use those opioids.
Thank you. And then consider safely disposing of your medications. So throwing them out, a throw out option. So you want to safely dispose of any medications that are left over or expired. And doing them safely, meaning you don't want to flush them down the toilet, you don't want to throw them in the trash, but really just taking advantage of drug disposal or medication disposal boxes that a lot of communities have. You can go to the Use Only as Directed website, and we do have the website at the end for you. And then you can search for those locations by zip code. So this is really a great kind of a great way and alternatives and safe alternatives to any medications that you may have in your household.
So to wrap it all up, the best way to tackle a problem is just to prevent the problem from starting in the first place. I want to share real quickly the upstream prevention analogy. So if you see somebody drowning in a stream, you're of course going to want to jump in and try to save them and try to help out. But then maybe you notice that there's another person, just as you save the one, another person's drowning and you have to go back in and try to save them. And then there's more coming down the stream, drowning. And you're like, what is going on here? Well, if you look upstream, you may notice that there was a a break in the guardrail that was keeping people from falling in the stream. And if we can fix that guardrail and put it in place and put safety precautions in place, we can prevent the problem before it even develops. And so these speak out, opt out, throw out options are safety precautions that we can have around opioid prescription medication so we can prevent the danger of addiction. The opidemic.org has more information for you, lots of resources. And so we just refer you to these so that you can make wise decisions with opioid prescriptions, manage pain safely. Thank you so much.